Good morning. My name is Kimberly Bannister, and I'll be providing you a presentation on the insertion. So I wanted to keep this lighthearted. Foley maintenance can be taxing, so make sure. At the conclusion of this lesson, the student will be able to explain the urinary catheter insertion process by oral responses to questions provided by the instructor. Also, at the conclusion of this lesson, the students will be able to perform the urinary catheter insertion for male and female using sterile technique on a static mannequin in the simulation lab, and this will occur after this presentation. During this presentation, we will discuss the indications for a urinary catheter, the familiarization on the insertion of an indwelling. So right now we're actually going to find out what your experience is with the urinary catheter insertion and our Foleys that are already indwelling. So using your smartphone, we're actually going to get out the Poll Everywhere app. We're going to open it up and go ahead and go to the site. The question is, what is the number of patients that you've encountered with a Foley catheter? And so you're going to answer by categories. It's either 0 to 2, 2 to 3, 3 to 5, or 5 or greater. And we're just going to take a look here on the screen, and I'm going to give you a few minutes to do that, to get there to the site and answer that question so we can kind of see where everyone's experience is at. So I'm actually going to open this up to the group. Does anyone have any ideas on why a patient would have a urinary catheter placed? Why a physician would order it? Okay, good. I'm just going to go over those a little more detail. So acute urinary retention, that patient has difficulty voiding. We've bladder scanned them multiple times and they're unable to void. So we place the urinary catheter. A need for accurate measurements, so those critical ill patients where they need specific number of output as well as input, they need to balance those out. We'll have the urinary catheter inserted. Patients that require prolonged immobilization, so those patients would be your multi-trauma injury patients, such as ones that have pelvic fractures, patients who are quadriplegic, and patients that have maybe a spine injury. Another reason would be to assist in healing an open sacral wound or perineal wound. So having a catheter placed prevents the urine from getting in those wounds and causing further infection. Perioperative use for selected surgical procedures. So those procedures that require a large volume infusions or diuretics during surgery, or those prolonged duration of surgeries, those are the type of patients that could receive a urinary catheter. And finally, for comfort care, so those end-of-life care patients where you don't really want to move them a lot and you just want to make them comfortable, so you place the urinary catheter for those types of patient, for that type of patient population. Now we're going to discuss the catheter preparation for insertion for a male patient. So we're going to gather our catheter supplies and we'll position the patient and then we'll prepare the tray. Now that you have your catheter tray set up, you go ahead and don your sterile gloves and place your drape around the penis. Go ahead and place the lubrication in the Foley tray as pictured here, as well as having the betadine. For insertion, using your non-dominant hand, you will hold the penis up with applying slight upward traction of the penis. And you go ahead and insert the catheter until you see urine. Once you see urine, continue to advance all the way to the bifurcation. And then you will go ahead and inflate the balloon based off of the manufacturer's guidance. For the preparation for a female patient and for inserting a urinary catheter, you'll go ahead and gather supplies just as before. You'll position the patient in a Sims position with their legs relaxed in a relaxed position, or they can also be side lying. Once the sterile drape is in place, fully expose the urethral meatus by spreading the labia. Maintain this position with the non-dominant hand throughout the procedure. Grasp the aseptic soaked cotton ball with the forceps, or pick up the antiseptic swab stick, whichever is located in your kit. Cleanse the perineal area, wiping front to back from the clitoris towards the anus, and use a new cotton ball swab for each area cleansed. Wipe the labial fold first, then the near labial fold next, and then directly over the center of the urethral meatus. With your sterile dominant hand, pick up the catheter and hold the distal end of the catheter loosely coiled in the palm of the dominant hand. Insert the indwelling catheter and ask the patient to bear down gently as if to void, and slowly insert the catheter through the urethral meatus. Advance the catheter until urine flows through the tubing, and after visual confirmation of the urine in the tubing, continue to advance the catheter. Once you have reached this point, go ahead and inflate the balloon per manufacturer guidance, and release the labia and hold the catheter securely with the non-dominant hand, and secure the catheter to the patient's legs. Again, maintaining that there is no kinks and no dominant loops within the tubing. Now that we've talked about fully catheter insertion, I would like to go over CAUTI. So CAUTI is catheter-associated urinary tract infection. It is a national patient safety goal, and as healthcare professionals, we can reduce the incidence of CAUTI. So per the Center for Disease Control, among the patients that require a UTI, 75% are associated with a urinary catheter. So this can be prevented. So thank you for that collaboration. Those were wonderful ideas that you had on CAUTI prevention. I'm going to go over what the CDC recommends. So maintain an obstructed urine flow. So that's what I talked about with Foley maintenance. Making sure that there's no independent loops, making sure there's no kinks, making sure it's not there's no that the urine is flowing. So those types of things you will monitor for when a patient has a urinary catheter. Another way is any breaks in aseptic technique. So when you're doing your sterile technique, if there's a break in it, then like I stated before, that you should start over again to prevent CAUTI. If there's any disconnection or leaks that occur, then you really do need to replace the catheter. Keeping the collection bag below the level of the bladder at all times. So again, don't set the bag on the floor, don't set it on the side rail. It really needs to have a level of, there should be a slight level of resistance downwards and below the bladder. And then of course, routine hygiene. So cleansing the medial surface during daily bathing or showering is appropriate. So there should be some routine hygiene going on when bathing the patient to prevent CAUTI. Here's a list of the references that I used when now I'm going to open the floor for questions.